And now, America's healthcare advocate, Carrie Hall.
Hello, America. Welcome to America's Healthcare Advocate Show, broadcasting coast to coast across the USA, from Alaska to Florida, all the way to Hawaii. My producer, Mr. Sean Floyd. I'm your host, Carrie Hall. This is your show, America. Thank you for joining us, making us one of the most listened to talk shows throughout the United States. You can follow me on Facebook, also on Instagram, and on YouTube at AHA Radio Show. That's Facebook, Twitter, Instagram, and YouTube on AHA Radio Show. Podcast platforms, iTunes, TuneIn, SoundCloud, Spreaker, Spotify, Odyssey, and you can do that. That's America's Healthcare Advocate. Those are the podcast platforms. We're doing a show today with Mo Jackson from Blue KC, Blue Cross and Blue Shield of Kansas City. I just told her that when we looked at our numbers on the podcast platform last month, we found out that the show you and I did had 3,100 people on the last Medicare show we did go up and listen to that Medicare show. So I guess a lot of people are interested in Medicare, Mo.
And as they should be. This is the time of year when you better become interested in Medicare if you're eligible for Medicare, because decision time is now. It's upon us.
Yeah, and we're going to get into all of that today. If you are one of those chronologically challenged people and you want help with Medicare, the lovely Joyce Thompson at RPS Benefits by Design is happy to help you. 877-385-2224. 877-385-2224 is the phone number. She is happy to help you if you need help with Medicare or individual health insurance, either one. So Mo Jackson, I said, in studio with me. She is the Medicare expert at Blue Cross and Blue Shield of Kansas City. We're happy to have her in studio. How many of these do you think we've done over the years?
I don't know. We've done a ton of them, and it gets really, really good now because you and I are so seasoned. Is the way I'll put it. We're well seasoned.
Yeah, we are. We've definitely done a few of these. There's no doubt about it. Well, let's just start off with, you mentioned it in your remarks there a minute ago, open enrollment. When does it start and when does it end?
So it opens on October 15th. Now, we can start talking about plans October 1st, but you can start buying a plan October 15th, and it goes till December 7th. And that's the time for you to make a decision on which Medicare product you're interested in and need to go with for 2023.
Yeah, and the time to make a decision is not December 7th.
No, please don't wait till December 7th. Get it done now. Don't become that procrastinator.
Yeah.
Go ahead and get your decision made. Do your shopping. Give us a call. We can help you walk down that confusing path of Medicare and help you determine what's going to be the best option for you.
Yeah, or as our producer Sean Floyd just said before the show, procrastination is the dish best served eventually.
Yeah.
We don't want this to be eventually. Okay?
No.
Yeah. No. So let's kind of get into some of the October 1st, when we start talking about October 15th, people can start to enroll. Let's start off with Medicare Advantage plans, and then we'll talk about Medicare supplement plans a little later on. But let's get into the Medicare Advantage plans. Blue Cross and Blue Shield's got 6 plans this year, and I'm looking at the top of the spreadsheet here, and the premium is 0, 0, 0, 0, 0, and 0.
It is 0, 0, 0, 0, 0, 0.
A lot of zeros.
Yeah, and if you look on down there, you'll see that also on our PCP is 0, 0, 0, 0, 0, 0.
Yep.
So no copay for your primary care physician on our plans, no premium on our plans, and we also give you some additional benefits that you will not get on a supplement or you would not get on original Medicare.
And we're going to get into those later on in the show, but let's go back and talk a little bit about some of these zeros. So x-rays, I'm looking at the plan again, is 0 for x-rays, 0 for diagnostic procedures and lab tests under the HMO plan, under the SpiroCare plan the same way, and then go into some of the other plans there and talk a little bit about those.
So on the Blue KC Essential PPO plan, for the x-rays, it's going to cost a $10 copay this year, and diagnostic procedures and tests is going to be $10. But for the most part, if you have looked at our plans in the past for 2022 or before, you'll notice that we haven't changed very much on our plans. They're pretty much the same across the board.
Yeah, they are. And you can also look at the Blue Simply Blue, KC Simply Blue plan.
Let's talk about that.
Yeah, those have zero copay on the x-rays, diagnostic, and on those issues. Talk a little about those.
Yeah, so one thing that I want to highlight on the Blue KC Simply Blue PPO plan is the fact that on that plan, it's a zero premium, zero PCP, no deductible, $4,800 costs for the maximum out of pocket, which nobody ever reaches that. But I can tell you that cost share is the same in or out of network when you look down at the benefit structure. So for the primary care physician in or out of network, it's going to be $0. For a specialist visit, it's $35 in or out of network. Doesn't matter. It's the same cost share in as it is out of network.
So I want to go back to something that Mo just said there. We call it the MOOP, which is the maximum out of pocket.
Maximum out of pocket.
Yeah, and that's $4,800. And people look at that and they jump, oh my God, I've got a $4,800 deductible. No, you don't.
You don't.
Okay, let me explain this a little bit so you understand it. The way that works is the copays add up toward that $4,800. When Mo said nobody ever reaches it, I can tell you in the 26 years I was doing this, I had one lady. She was 90-some years old, and she had been in and out of the hospital. It was a much lower deductible. She had been in a much lower MOP, in and out of the hospital, I don't know how many times a year, and she finally hit it. But that was the only person in all the years that I have been doing this, because the way it works is it's copays. So again, if it's outpatient surgery, it's $250 or $300. It's an observation stay, it's $300. Air or ground ambulance is $300. You add up the copays. You know how many copays you'd have to make to get to $4,800?
You'd have a bunch of them. And to your point, Carrie, I shouldn't have said that nobody ever does, because occasionally they do, right? It happens. But all those small copays or coinsurance go toward that $4,800 on that Simply Blue plan. But the difference between that and a deductible is a large amount that you have to reach before you ever get first dollar coverage, right? You have to pay out of the pocket, and that's not the way these plans work.
Yeah, so the biggest exposure you have here is if it's like an inpatient stay. So it's $300 a day for days 1 through 5. Okay, if I did the math right, that's $1,500. Well, why don't you take a look at what your group health insurance plan is, or your individual health insurance plan.
Or original Medicare.
Yeah, thank you. Or original Medicare, and compare all of that to that. So how many times do you have to be in and out of the hospital to hit $4,800? Okay, that's my point in explaining that to you. So don't look at that number and go, oh my goodness, no, it's not, okay? It's a series of copays, and as Mo said, and I'll say it again, I've never seen it. I had one person in all the years I was doing this actually hit it. Yeah. Okay, and she had a really bad year, but that was pretty unusual that even happens. So let's go on. Here's another plan. We've got about 2 minutes left. I don't know if we got time to get into this. The Blue KC Valor Plan. Now, I got a funny feeling I know why that was named the Valor Plan.
Yes,
that's
you probably know.
For those of us that are military veterans.
Yes, and thank you for your service. So the Valor Plan, we renamed it. It was the Flex PPO Plan, but we wanted to resonate. We wanted to resonate with those people out there that understand why this plan is built. And it is built for those people that are veterans that don't have a drug plan or a need for a drug plan, because this plan does not include a drug plan. If you continue to get your drugs from the VA, you can be on this plan and get some of the extra stuff we're going to talk about.
See, and this was not available a couple of years ago. This is something new that Blue Cross brought into the equation. I think it's really cool. I love the fact that they renamed this so you understand what it is. So, if it's your dad or your grandfather, and they're going to VA and they're getting their medications at VA and they want to have private care, this Blue KC Valor Plan might make a lot of sense for them, because it still lets them get their meds from the VA, but they can access all these other benefits and had zero premium, same thing, okay, and all these other benefits that are on here, and zero copay for primary care, the x-rays, diagnostic procedures, etc. All of that is available, and it's private health care. You're not going through the VA to get it, and that's
but
pretty
let's
important.
Be clear, Carrie, on that Valor Plan, you don't have to be a veteran to have that plan. If you've never had a drug plan, don't need drugs, you can still have that plan so you aren't penalized.
Well, see, I didn't know that. Now, that's pretty interesting.
Yeah.
So there you go. So it's available for anybody. But again, it's called the Valor Plan because it really was designed to give veterans the option to stay on with the VA. When we come back from the break, we're going to talk more about this with Mo Jackson joining us in studio from Blue Cross and Blue Shield of Kansas City. If you want information on this, call 833-261-1596. That's 833-261-1596. One of their representatives is happy to sit there and talk to you, explain this to you. They're right here on Main Street. Okay, it's not some call center out of state. Okay, and you'll be able to chat with him and get help if you want to do that. Stay tuned. We'll be right back with more. You're listening to America's Healthcare Advocate, broadcasting here on the HIA Radio Network, coast to coast across the USA. We've got more. Don't go anywhere.
Because it won't be long before I truly will be through. Whoa, tell me, darling, am I right? Am I right?
Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the fruited plain here on the HIE Radio Network. You can learn more about us at the website healthradio.us, healthradio.us. My producer, Mr. Sean Floyd. I'm your host, Kerry Hall. In studio with me, Mo Jackson from Blue KC. She is the in-house expert at Blue Cross and Blue Shield on Medicare, and every year we do this show to talk about what they're doing, what's different this year, what's new. There's quite a bit. We're going to get into a lot of that in the next segment in terms of things that are out there that you may want to know about. You know, if you want to just talk to somebody, they're right here on Main Street. This isn't a call center in New Jersey or something else, okay? You want to talk to these people. They really do know where north of the river is and what Kansas City North Hospital is or where Liberty is, okay? So if you want to call them and have a conversation with them, 833-261-1596. Look, there's 6 of these plans. There's a lot of information here. They can walk you through all of that. You can also go down there. If you want to walk into the lobby on Main Street and sit down and talk to one of these people, they are happy to do that. Once again, the phone number, 833-261-1596, 833-261-1596. Let them help you make a good decision. All right, so I got to do this because I referenced this, okay? And we're going to talk about this plan. It's called the Blue KC Give Back Plan. You know, one of the things that I get just drives me nuts this time of year is the ad nauseum ads with Jimmy Walker and Joe Namath talking about we're going to give you money back. Like this is some secret deal that only they and their group of people know about. And
Right.
It's not.
No,
Okay.
it's
So first of all, talk about the Give Back Plan because that's exactly what these guys are talking about. Okay. But of course, they're making it sound like it's something that only they have access to and it's special. It's not that.
Yeah. So, I mean, to Carrie's point, this is it's an opportunity for carriers such as Blue Cross and Blue Shield of Kansas City to give back for the Part B premium that consumers are paying for. So, this is a plan that's built around people that are wondering, why am I paying for all these healthcare costs when I'm relatively healthy? I might see my PCP once or twice a year, and on our plans, that's a zero cost. So why am I paying all this money, including a Part B premium? What we're doing, we're taking this plan, which is called the Blue KC Give Back PPO plan, and anyone that's in our service area, in the PPO service area, can be on this plan, and you can get $75 back on your Social Security check for the Part B premium that you've already paid for.
So does that take all the mystery out of this, people out there, so you understand? That's exactly what you're hearing Joe Namath and Jimmy Walker. That's what they're talking about. It's no great mystery. It's not something that they're the only people that have access to. That's what this is, of course. And I'm going to reference this because I said this, coming in off the break. Remember, when you're talking to the people at Blue Cross of Kansas City, you're talking to the people right down there on Main Street, okay? These are the same people that are in your PTA, belong to your church, they're your next-door neighbor. They understand Kansas City. It's not a call center sitting out in New Jersey someplace or Florida or someplace else.
Right.
This is a different deal. And I think that's important. The other thing you need to understand that, Blue Cross has won multiple awards for their customer service because they do such a good job of that. That's the difference between a hometown carrier and some of these other carriers that are out there.
Yeah, I can tell you that we're local. I mean, we are local. I live locally. Everybody in my office that come in every day, they live locally. We're all right here to take care of and help you with your healthcare needs.
And they understand the provider networks. Like I just said earlier, they know where North Kansas City Hospital is. They know, where St. Luke South is. They know that, they know Latham Medical Center. They know they can, if that's where your doctor is, if that's what you need to know, they're going to be able to help you with that.
We can pronounce it. We know where it's at. And we also know what's important to Kansas City as far as having that valued network available to everyone. But let's get back to this Blue KC Give Back PPO plan. Again, it's $75 back as long as you are paying your Part B premium. So, Carrie, there are some people that wouldn't qualify, but simply because they may get extra help or someone else may be paying their Part B premium. But for those of you that are paying your own Part B premium, you can get $75 back on this plan, and it still has pretty robust type benefits. It gives you that zero cost for your PCP. And then we have another plan, Carrie, I'd really like to spend some time talking about, which is our SpiraCare HMO. Now, you mentioned earlier that all our plans for 2023, everyone has access to our SpiraCare clinics.
And that's the first time this has happened.
First time it's ever
Big deal.
happened.
This is another reason why we do these every year.
Yeah.
Because SpiraCare wasn't available across the board until this year.
That is correct. And this is very, very manicured, for lack of a better term, PCP-driven clinic business. And I can tell you from my own experience, I've gone in there and I'm not sitting in a waiting room with 100 people, right? And it is very precise as to what my needs are. I get taken right back. I get taken care of. They do the follow-ups. They set my appointments. Everything's taken care of for me. It's a phenomenal experience. You can have that on the SpiraCare HMO, or you can experience it through any of our plans.
You know, I go back to a story that happened here a couple of years ago. A fellow who, another broker by the name of David Hickman, signed up for SpiraCare, put his whole company on it, and his son went in on a Saturday to go to the SpiraCare Center, and he needed to get an x-ray or something that they couldn't do there that day. They gave him a gas card and told him to go get to the other SpiraCare. He called me up to tell me, I don't believe this. They gave me a gas card the point is that the care level at the SpiraCare centers, have you ever been in one of these things? They're beautiful.
They are.
They don't look like a hospital ER or like an urgent care or anything. These places are absolutely beautiful. You've got somebody in there that is a care team member that, you know, what's your problem? What can we help you with? They're going to take you back. You're going to see a nurse practitioner, see a primary care physician, whatever you need. Prescription drugs, x-rays, lab work, it's all right there.
Yeah.
You just said, now I need to go see a specialist. Well, here's the specialist.
Yeah.
We'll make the appointment for you. So rather than you sitting on hold,
Right.
going through 14 voice prompts at a
Right.
particular doctor's office, and you're not going to talk to anybody, you can go to the nurse line and leave a message.
Right.
You've actually got somebody picking up the phone and doing it for you, and they don't have to go to the nurse line because they're the provider, and they're going to be able to get you right in and get it taken care of. So all of that nonsense you would have to typically go through is gone.
It is.
Okay, and it's a one-stop shop.
It is, and it's a phenomenal experience. And they can do same-day or next-day appointments for the sick care. They don't want you to treat it like an urgent care or an emergency room, but it is for sick care and for your chronic conditions, your PCP care, and give them a call, and they'll be able to help you set up the appointment and get you started on that journey. It's a wonderful journey.
Yeah, it is. It's really good. And there's also, and this is unusual, none of the other these kinds of clinics that are popping up around town, there's also behavioral health here, which is a big deal. It's right there in the facility. If you have a need for that, it's certainly there. If you want information, you want anything from Blue Cross and Blue Shield, call them at 833-261-1596. 833-261-1596. Those folks down on Main Street are happy to talk to you. If you just want them to walk you through this, you know, this is not a high-pressure sales deal. You know, back to the Jimmy Walker, Joe Namath model. These folks are here to help you make a decision. If they can help you, they will. 833-261-1596 or MedicareBlueKC.com. That's the website. We'll be right back after the break. We're going to get into what I call the bag of goodies after this. It's pretty extensive this year, so stay tuned. We'll be right back after the break. You're listening to America's Healthcare Advocate, broadcasting here on the HI Radio Network, coast to coast across the USA. Don't go anywhere. We've got more. Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA here on the HIE Radio Network. You can find out more about us by going to our website, healthradio.us, healthradio.us. That is the website. We did change it from America's Healthcare Advocate because somebody was plagiarizing the name out in California. So healthradio.us. Okay, so there's a lot of information here. It's like drinking out of a fire hose, listening to all this, right? The podcast platforms are there for that reason, and so is YouTube. Okay, so go to the podcast platforms, SoundCloud, TuneIn, iTunes, Apple Play, Spreaker, Google, Odyssey. We're on all of those platforms, and in addition to that, we're on YouTube now. and the YouTube is AHA Radio Show, AHA Radio Show. And there are a lot of people using that, which I was skeptical whether that was going to work or not, but it's up there. So you want to tell somebody about this or listen to it again or talk to your husband or your wife, that's a great way to do this. So my producer, Mr. Sean Floyd, in studio with me, Mo Jackson from Blue KC. She is the in-house Medicare expert, and we are talking about all things Medicare. It's open enrollment. Okay, so, October 1st, we start talking about this. October 15th is when you can start enrolling. You have until December 7th. Don't be the procrastinator with the dish eventually served, okay?
Yeah.
Yeah. Be the person that gets it done in a timely manner and get it in play. Because you wait until the last minute, and then their phones are ringing off the hook, the websites are jammed up, and they're trying to get this stuff done, and it doesn't make any sense. The time to do it is now. Talk to somebody. If you need some time to think about it, that's fine, but at least get started with the process. If you want to do that, call them at 833-261-1596, 833-261-1596, the website, MedicareBlueKC.com. All right, so every time this happens every year, I look at this stuff and I'm going, how are they going to get any more stuff in here? So I'm doing show prep before to come in here and do the show, and I see that there's housekeeping on here, and I'm like, something's not, there's a mistake, something's wrong. There's not, okay? Just talk about some of this and the reason for this, people, that they do all of these extras that come with these Medicare Advantage plans, it's really simple. They're competing. They're competing with all the other carriers out there to get your business, and they're adding in all of these extra things to give you extra opportunities. So let's just start with housekeeping.
So housekeeping, it's a great segue into this conversation because everybody wants somebody to come out and clean their house, right? I would like somebody to come out and clean my house. I'm not of age quite yet, getting there.
Yeah, you got a long way to go, dear.
But this, what Carrie's referring to is actually called Papa Pals, and Papa Pals is actually a vendor that we engaged to go out and do daily activity support. So it's caregiver and companionship support called Papa Pals. And all of our members that are on Blue Cross and Blue Shield of Kansas City's Medicare Advantage plans get 40 hours a year of this type of support. They come out to the home and they'll do things like light housekeeping. They'll come out and they'll set up your new iPhone. They'll come out and
wait, slow down. They'll come out and set up the new iPhone?
They'll set up the new iPhone.
I thought you'd only do that if you had a 12-year-old grandson, but all right, so that's good to know.
Yeah, these are college, a lot of college kids.
Those things are ridiculous. I'm looking at mine. No way.
Yeah.
Yeah.
So they'll come out and set up the iPhone. They'll come out and they'll help walk your dogs. They'll take you up to the airport if you need a ride to the airport. They'll take you to Walmart if you need to go pick up your over-the-counter meds. Various different things, and it's 40 hours a year, and it's at no cost to you, everyone gets it.
That's wonderful.
Yeah.
I mean, maybe you've got guests coming in from out of town, and you got to get the house clean. You're trying to do all these other things. You pick up the phone and call them. They come out and take care of you.
Yes, they do. Now they're not going to do the deep cleaning, but they will do the light housekeeping, right?
Yeah.
That's just one of the many different things that we're offering for 2023 as far as the benefit extra highlights. We also have something called the Personal Emergency Response System. Carrie, do you know what that is?
I have no idea.
That is I've fallen and I can't get up button, right? So you remember the commercials.
Yeah.
It's that button that they can wear around their neck or on their wrist, or they can hang it on their bed. But it's a button that gets them emergency care right away. So if you actually do fall in the tub, you can push that button and it alerts someone, and they talk to you via this device, and they'll get somebody out there to help you as opposed to something else happening to you.
Now, we talk about the sandwich generation sometimes on this broadcast when we do these shows, and that's the folks that have, that have got parents that are in their 80s, 90s, et cetera, and they're trying to take care of them. Maybe you're out of state, okay, or maybe you're on one side of town and they're on the other side of town. This is the kind of thing that makes a lot of sense.
It does, and you know why else it makes sense is because there's also an app that goes with that device that I could try to help manage my mom's care, because I can't be physically with her. I can actually see if she's gotten up in the last 8 hours. I can see if she's stranded or far away from somewhere where she's at on this device. So it's a great opportunity for people to get this. And again, this is for everyone. It is not one of those situations where it's only for these set of things. Everyone can get one of these.
Okay, so let's talk about some of the other ones that are really great. Let's start with the over-the-counter benefit.
So yeah, the OTC, everyone loves what they can get with the OTC benefits. And on our plans, most plans include either a $500 or a $400 benefit. Now the $400 benefit is $100 per quarter, and that's on the Essential plan, to name one, and it rolls. So if you don't use all the $100 in the first quarter, it's going to go to the second quarter. And then you have the Simply Blue plan. It's going to have a $500 over-the-counter benefit. So you can buy your things like your vitamins, your pain relievers, your cough drops, all those type of things with the OTC benefit.
And the flex benefit allowance, this is another one that's a big deal.
Yeah,
I
so
mean, think about all these people keep adding this stuff up.
Yep.
Okay.
That is called the Blue Benefit Bucks. So that is the flex benefit, and that includes either a $500 or $1,000 benefit for those things like hearing, transportation, vision, or dental. So all four of those things are included in the flex benefit, and all it is they can use anybody, whether they're in or out of network. It doesn't make a difference. That is a vendor for such things. So, for instance, Lyft or Uber, they could use that with the transportation benefit and use that $500 or $1,000.
Wow, that's pretty nice that you could use Lyft or Uber. And so if you needed to go to the grocery store or you needed to go to a doctor's appointment, you didn't feel like driving or you weren't capable of doing it that particular day, you could use that. Before we get out of this segment, though, I want to talk a little bit about the fitness program because it's expanded this year and it's a lot different than what a lot of other carriers are offering.
You mean the Silver Sneakers?
Silver Sneakers plus a few others.
Well, you're going to have to fill me in on the others, but I can tell you the Silver Sneakers program is still available to them. And with the Silver Sneakers, we did expand part of that with the healthy benefits or healthy rewards. So if they use a Silver Sneakers fitness benefit 10 times a month, they're going to get $10 for doing that on their healthy rewards benefit.
That's a pretty good benefit.
It is a real good benefit.
Yeah, so they have access under Silver Sneakers to what kind of clubs?
So they have access to things or clubs like Genesis, clubs like 24-Hour Fitness.
That's what I was talking about.
Oh, the Genesis. Yeah, everybody
you've got
loves
Genesis,
to go to the
24-Hour
Genesis.
Fitness, YMCA.
Yes.
It's expanded to, there are an awful lot of health club facilities.
And they can find that by going to silversneakers.com and looking at the places that are close to them and finding out what the amenities are.
Yeah, and that's really kind of cool because that's some of the other wonderful benefits that are available here.
Something else I want to talk about, Carrie.
Before we go to break, go ahead.
Yeah, real quick. So we also offer, and it's for people with chronic conditions, so I don't want to expand this too far, but we have something called Bell Cares, and this is in-home pedicures for people that qualify for in-home pedicures. So people that may have a chronic disease, diabetes. Vascular issues, neuropathy, wound care, things like that. They can have someone come into their home and do a dry pedicure and massage their legs and even paint their nails if they produce the color. They have to give them the color, but they can have it done.
Yeah, you can get your nails painted.
Once a month for 12 months.
I mean, does it sound too good to be true? But it's not, okay? All of these things are available under these plans. And, the reason for this is simple, people. They're competing with the other carriers to get your business, okay? And they're putting in these kind of programs to give you opportunities to do things that aren't available on a lot of the other plans. And that's really important to understand that. And that's why it's important to talk to somebody, okay? That's why you pick up that phone and you give them a call and go back through this. Listen to what they have to say and see if this is what you want to do. You can do that by calling 833-261-1596, 833-261-1596. When you come back from the break, I'm going to talk about all the counties that this is offered in. So you're going to be a little surprised. That's also grown this year. And another opportunity for folks all around the metro. This show airs on 13 stations here around the Kansas City metro. So when you're listening to this, you'll know that it's available in your area. Once again, if you want to call them, 833-261-1596. The website, MedicareBlueKC.com. We'll be right back after the break. You're listening to America's Healthcare Advocate, broadcasting here on the HIA Radio Network, coast to coast across the USA.
Before our true love will be through. Whoa, tell me, darling, am I right?
Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the fruited plain here on the HIA Radio Network. You can find out more about us by going to the website healthradio.us. Also, podcast platforms. The show is up there. It'll be Blue KC Medicare Advantage plans. You can listen to the show. All of this information is on that podcast, just like we did it here in the show. Okay, so you could hear it up there. Go back and listen to it again. Tell somebody about it if you want to do that. Also on YouTube at AHA Radio Show. We post them up there as well. A lot of people seem to like that YouTube thing, so you can do it there either way. If you want to talk to somebody, and I urge you, if you're thinking about this, to pick up the phone and give them a call, 833-261-1596. Look, this is not a high-pressure sales deal where they're going to try to close the deal. You want to just call them up and say, I don't understand this, or I'm on this plan. Why is this one better? Why is it different? I heard it on the radio show, whatever the case may be. Pick up the phone and call them. They're happy to talk to you. That's why they're there, okay? And they are, like I said, right down here on Main Street, so they're happy to chat with you and help you. 833-261-1596. That is the phone number. All right, so let's talk about, because it's, again, another one of the reasons why we do this show. It's expanded this year. Let's go through all of the counties because we got a lot of counties to talk about.
Okay, great. So the first thing we want to cover, once again, I just want to reiterate to everyone, SpiroCare Clinic access is available in all our plans. So that is one big takeaway. The second takeaway I have for you is that on the SpiroCare HMO plan, we did expand that into Jackson County, Missouri. So you can live in Johnson or Wyandotte in Kansas or Jackson County, Missouri, be on a SpiroCare HMO and have access to all those clinics and those wonderful benefits that are on that plan. And
at Lafayette, Platte, Ray, and Wyandotte, right?
So we have Cass, Clinton, Clay, Jackson, Johnson, Kansas, Lafayette, Platte, Ray, and Wyandotte, Kansas, all in the secure HMO plan. Okay?
That's pretty good. And
then,
Jackson's new in Missouri. That was not on here.
For SpiroCare, it is new. That is correct.
Yep.
And then if we move to the PPO plans, we did expand into 3 counties, but I'm going to give you the whole county listing. So we're in Andrew, Bates, Buchanan, Cass, Clinton, Clay, Henry, Jackson, Johnson, Missouri, Lafayette, Platte, Ray, St. Clair, and Vernon in Missouri. And then we're also in Johnson and Wyandotte in Kansas. So we've expanded into Vernon, St. Clair, and Henry in Missouri for 2023.
Yeah, I think it just about covers the whole broadcast area for this show. So it's important to understand that these plans are county by county, and that's why we want you to understand, that they're available now in your particular county if you're in one of these counties. So that's important. All right, so let's cover prescription drugs because this is a really big deal to people. They need to know that they've got coverage for the drugs. Let's talk about how the coverage this year from Blue KC is working. And that means the Part D drug plan is included inside of these plans with everyone except the Valor plan.
That is correct.
So
Good job.
That.
So, we have prescription drug medicine available on, that comes with a formulary for the drugs that we cover. And on these drugs that we cover for Tier 1 and 2 coverage, we have 100-day fills at no cost, either retail or mail order on our plans that have the drug coverage. 100-day fills at no cost, Tier 1 and 2, retail or mail order. And that's important to know. You don't have to use a mail order if you don't want to. You can use a retail stores. And we do not have a preferred pharmacy network. So pretty much wherever you want to go.
Oh, so unlike some of the other plans the carriers had where they do have preferred farm, you guys do not have that. And so that's another thing. Some people don't like mail order.
They don't.
So now they can go get 100 days at the pharmacy?
They can. They can get their 100-day fill at the pharmacy for Tier 1 and 2 at no cost.
That's pretty good.
It is real good. And then we have gap coverage on the HMO plans for Tier 1 and 2. So through the coverage gap, they're still.
You want to explain coverage gap so people know what you're talking about here?
Well, I can tell you that there is an amount that you have to meet, right? That the plan and you pay for, and then you get in what they call the coverage gap or the donut hole. And when you get in the donut hole, normally your costs are your own. But in this, we cover it.
Yeah, so that's important. Again, like I said, there's a lot of information here, right? And that's why it's important if you want to understand this better, you can go listen to one of the podcasts, and that certainly helps. Or you can simply call them at 833-261-1596. Before we go to the end of the show here, let's talk about the insulin program and what's available there, because that's been a problem for a long time for a lot of seniors, is that they either didn't have the money, they ration that stuff and not take it when they're supposed to, as often as they should, because they simply didn't have the money to pay for it.
Right. Not adherent.
That's all changed.
Yeah.
So now talk about that.
So, yeah, last year we started with the $35 insulin program. So all the insulins that are on our formularies that have drug plans, they can get those at $35 through the coverage gap. So they're going to pay at the most for their insulin $35 if they're a diabetic and they need it.
Yeah, and that's pretty amazing.
It's real amazing because, to your point, a lot of people, they split it. They try to ration it, or they just don't use it at all because it costs too much. Now it's affordable. Now they can use it, and now they don't have to ration.
Yeah, and then they get sick.
Yeah.
Because they aren't taking what they need, and then they wind up with, losing a toe or a foot or something else.
In the emergency room, inpatient hospital, skilled nursing, it just goes on and on and on.
It snowballs, and it's not good. So we're wrapping it up. What do you want to say to the folks before we wrap it up here, Mo, about Blue Cross this year and what you all are doing?
Very excited to tell you about the benefit structures that we have for 2023. I want to really make it clear. Don't be one of those people that wait till the last minute. Go ahead and make that decision. Get it off your plate, right? Just get it off your plate so you're not serving that down the road. Go ahead and don't be a procrastinator. Make your decision. Call us at Blue Cross and Blue Shield of Kansas City. We're more than happy to help you.
And again, you can call them. You don't have to make the decision we call them that day. Call them and talk to them. I need to back and talk to my wife. I need to talk to my husband. I need some time to think. That's fine. But you've got to start the process if you're going to get to a point where you're going to make a good decision in a timely manner. And the way to do that is call them at 833-261-1596, 833-261-1596. They're right here in town. There aren't any other carriers can say that. Okay, they're right here. Their folks are right down there on Main Street. They have award-winning customer service people, and it's a great way to get help if you need help. 833-261-1596. And now I leave you with this thought from Albert Einstein: the one who follows the crowd will usually get no further than the crowd. The one who walks alone is likely to find himself in places no one has ever been. Remember, friends, it's the funny thing about life. If you refuse to accept anything but the very best, you most often get it. Thank you for listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA. Goodbye, America.